393 people died yesterday, and it included the biggest daily increase so far of people with no underlying health conditions. That means the total number of deaths is now 1,808. The increase looks frightening, but health officials anticipate the number of deaths reported each day will rise until the virus is under control. So how should we interpret this increase? Well, if you look at what's being termed the rate of growth, that's the number of days that deaths take to double. That rate is still in the 3-day zone. It's worth remembering that many of the patients whose deaths were announced yesterday did actually die more than a week ago, so it might still be a week or two before the impact of lockdown shows in these figures. We need to talk about this in more detail, don't we? Just going to wander over here and pick up my notes because I want to speak to the Minister in charge, and this is going to be a tricky conversation this morning. Mr. Jenrick, you have chaired the daily briefings, so you know exactly what is going on. Let's start with testing. I think it's fair to say that the government's starting to lose public support, mixed messages from ministers, then corrections from number 10. Let's use this 10 minutes or so to clarify what's going on. How many tests did we do yesterday?
On Monday, we tested 8,240 individuals. This weekend, we tested over 900 NHS staff. So we have now begun to move away from testing solely those who are in critical care, the patients in the greatest danger from coronavirus, to ensure that we understand what condition they have and then can treat them appropriately, to testing NHS staff. And
Mr.
I appreciate
Jenrick,
that
sorry, we've only got a limited amount of time, and we just let's deal with the facts this morning, should we? We understand the other stuff. So well, 8,240 people were tested on Monday. We said that we would get up to 12,500. That's what the government told us per day. When? Give me a date. When is that going to happen?
Well, I hope it will happen in either today or tomorrow. We now have capacity to test 12,750 people every day. We were focusing the capacity that we had on people in critical conditions, which was on medical advice, because that was the best way to save people's lives, so that hospital staff could understand what the condition was of those people who are in critical care and know how to treat them appropriately.
Yeah.
Because we now have more capacity, clearly not as much as we would like, but we have more capacity, we're now able to begin to test NHS staff.
Okay,
and
Mr.
so
Jenrick, again,
a procedure
let's just deal
purely
with
on the
the bare
individuals
facts
in
this
critical
morning.
care.
We understand that. We've got it. You tell us every day, along with your colleagues. We get it. It's going to be a tricky conversation this morning. Let's get on with it. When will we be up to 25,000 tests a day? Give me a date.
Well, we've said that we'll hope to be in that position by mid-April. We think within days we'll be able to go from our present capacity, as I say, of 12,750 to 15,000. So that's a significant increase, but still not as far as we'd like it to be. And then mid-April is when we expect to be at 25,000. But we now do have enough tests, and this is an important point I was trying to make, to test not just those patients who are in critical care, but to begin to test NHS staff, which is obviously absolutely essential.
Fine.
And we're 15th
of April, 15th of April will be up to 25,000 a day. Germany is testing, well, they tested 1 million last week. We were told by your colleague, Michael Gove, that there was a shortage of chemical reagents, which is why we weren't having the number of tests that we had been promised. The Chemical Industries Association says that this is not the case, that it's not the case. We have enough of these reagents to do the tests. Who is wrong? You can't both be right. Who's wrong?
Well, the position, as I understand it, is that you need a number of different ingredients to make an efficient test. And we have some of the ingredients available in the UK, but not all of them. And so we need to bring together the right group of chemicals and other materials to produce the tests. We are trying to do that. The industry is doing a fantastic job, but this is a huge effort. They're ramping up supply. We're importing materials from overseas. But I think, as we can all understand, there's extremely high demand internationally. All other developed countries want to be procuring these tests at this moment because testing is essential
Okay.
to providing an exit strategy
We
from the
understand that,
virus.
Mr. Jenrick. Sorry,
but the
Mr.
numbers that
Jenrick.
we
We
are
only have a
producing now
limited
are
amount of
significantly
time.
higher
We
than what they were just
understand
a
that.
few days
I'm
ago.
asking you for the numbers this morning, please, sir, if I may. Just the numbers. We understand the other stuff. We've been talking about it for a month. As far as Novosit is concerned, they produce these tests in the United Kingdom. They say it's not the tests, it's the facilities. We don't have enough facilities. As a result, they're exporting these tests to 80 other countries because we cannot do the tests because we don't have the facilities. Is that right or wrong?
I don't know, I'm afraid, the specifics of that company. But what I do know is that we are working with as many of the British manufacturers we possibly can and seeking to import these from other countries around the world. As I say, demand is obviously very high for these because everybody is seeking them at this moment. It's a global pandemic. That's the nature of the situation that we find ourselves in. But we are able now to finally begin to ramp up supply. We are also doing some novel things like creating a test where NHS staff will be able to take it in the comfort of their own home and then post it off to be
Mr.
tested and
Jenrick,
get the
let's
results.
just stick
That
with the
will make it
questions.
much
Let's
easier.
stick with the questions this morning, please, if I may. We don't have time. The World Health Organization says Britain is too slow. The Health Protection Agency is too slow to roll out these tests. Are they right or are they wrong?
Well, the World Health Organization said overall that they support our approach. Different countries have taken different approaches to this, and I think whilst it's helpful to compare ourselves to other countries, and we are doing that, obviously, there are limitations to that because we have chosen a particular path, and different countries will make different decisions in terms of the types of people that they test. And I think we will obviously learn lessons later on as to which country got this right. But what we're trying to do at the moment is get as many of the tests brought forward as we possibly can.
Obviously.
And although I appreciate that it's from a base that is lower than any of us would wish, we are now making significant progress.
Okay, so the World Health Organization is wrong to criticise us. We'll have enough tests that we need by the 15th of April.
No, I didn't.
Let's see.
What
did you say?
Kay.
I'm just asking you straight questions. So if you can give me a straight answer, that would be great.
Well, I'm trying to, Kate, but what I was saying was that different countries have taken different approaches.
Okay.
We've taken ours on the basis of medical opinion, but what we're doing now is working as hard as we possibly can with the manufacturers that you've mentioned and others to get as much supply into the system as possible.
Okay.
And the important news in the last few days is that we now have sufficient capacity to begin to test NHS staff who obviously deserve to know how they stand and to be safe in the workplace.
As indeed do all of those people that are in lockdown that are listening to you this morning. We are only 2/3 of what you promised that they would have. But let's see. Let's talk about ventilators. How many do we have today?
Well, we have over, I think, 12,000 ventilators at the moment. And the good news that we announced yesterday was that the first of the ventilators that were being made by British manufacturers, these are manufacturers who weren't producing ventilators just a couple of weeks ago, before we put out the call for innovative British companies to come forward, have now produced ventilators which have met standards, they've been tested, and are now able to come into circulation and to be used by the NHS.
So just
We've taken receipt of a small number of them.
So just to clarify, how many do we have today?
We've taken receipt of a small number. So
just to clarify, how many do we have today?
Well, we've taken receipt of 30 of the new ventilators made by British manufacturers. I appreciate that's a small number, but that's just the beginning. And we expect that over the course of the next week, thousands of these British manufactured products will be able to come online and go into great new hospitals, for example, like the Nightingale Hospital in London. And that
how many will we have by the end of the week?
How many ventilators in total will we have, or how many of the new ventilators?
How many in total ventilators available for people who need them by the end of the week?
I don't have that figure to hand, Kay, but we will have, as I say, we think by next week we'll have thousands more ventilators than we have today.
Okay.
So, these are, bearing in mind that just a few weeks ago we had around 5,000.
How many will we have by the end of next week?
Adding.
How many will we have by the end of next week? You're putting the orders in, you must know. Well, how many will we have by the end of next week?
Well, it's not quite as simple as that, because
why not?
These companies have never produced, because these companies have never produced ventilators before. And so with respect, we're asking them to do something, and they've responded amazingly by producing products to
How
a
many have
very
you
high
ordered?
standard that didn't exist just a few weeks ago.
How many have you
We've
ordered?
ordered as many as they.
How
We've
many?
ordered as many as these companies. No, you're not allowing me to finish my
I
sentence.
am.
We've ordered as many as these companies are able to produce, and we believe that they'll produce thousands within the next week or so.
How many do we need?
And that's a big step forward.
According to the modelling, how many do we need by the peak?
Well, there are different assumptions there, but we do need a significant increase in the number that we have today. We're obviously building new hospitals like Nightingale, 4,000 beds. We need to ensure that has the appropriate equipment alongside those beds, and
so
that will mean hundreds, if not thousands, of more ventilators to be available for patients.
Mr. Jenrick, let me ask you, because we're almost out of time. Let me ask you about PPE. We were told that everybody on the front line who needed PPE had it. Then we were told yesterday in the news conference that that wasn't the case. Tell me, geographically, where people on the front line are, people who are putting their lives on the line for us, geographically, where do they need it this morning, and when are you going to fix it?
Well, we've delivered around 170 million items of PPE to people on the front line, and we've delivered those to about 58,000 different healthcare settings.
Not answering my question, Mr. Jenrick.
Well, look, I'm not sure what your question was. You asked me which specific
let me ask you more specifically. My question is this. Mr. Jenrick, let me ask you it this way, please, if I may. I know it's my last question. My question is this, if you could just answer it. Geographically, where do people on the front line need the equipment today? Because yesterday you said that they didn't have it. Where do they need it this morning, and when will they get it?
Well, there's two elements to that. Firstly, Public Health England will be publishing shortly guidance which sets out what type of PPE different people on the front line require to do their job in a safe manner. And that will range from people in the most critical situations in hospitals to other public services like social care and the men and women who are in refuse collection, for example. So everyone understands what the type of which PPE. The second point is, how can we meet the demand for it? And there are many places across the country who are putting in urgent requests for PPE. We're doing that in a number of different ways by having a PPE hotline. So if you're listening to the programme and don't have the supplies you need, immediately, and they should be able to provide you with a delivery of PPE as quickly as possible. We're also using the military to move around the country the supplies that we do have, because in some parts of the country there is excess supply awaiting the front line.
Where?
In other parts of the country, there's a lack of supply.
Where?
So we're using the military
Jenrick?
to distribute it as efficiently as possible. Well, it's a very fluid situation. I mean, for example, just a few nights ago, there was a shortage in some settings in London, and yet there was also a large supply in London. So the military stepped in and ensured that was distributed to a range of settings in London. So we're trying to create a much more efficient system for distributing the very large amounts of PPE that are now flowing to the people who actually need it.
But
this is
Mr.
obviously
Jenrick, with respect, as you said to me, with respect, Mr. Jenrick, with respect, as you said to me, we're 10 days away from the peak. How can doctors and medical staff on the front line not have what is going to save their lives? How can that possibly be? Surely you have to accept that you've failed.
Well, we want to get everyone who's working on the front line the equipment that they need.
Why have they not got it now?
We're working extremely hard to do that. I think with this challenge, there is now a lot of material flowing into the system. What we're trying to do logistically is ensure that it reaches those people who are working on the front line as quickly as possible. As I say, we're doing that now, working with distribution companies, with the military, who've been superb, with a hotline that helps even very small settings, like perhaps a small care home, to get access to the material by phoning up and asking for it as quickly as possible, and also coordinating that on a local basis through what's called our local resilience forums, where if there's an emergency situation, they can step in and move material from one part of their region to the next. We do expect this situation to improve quite rapidly because there is a lot of supply in the system, albeit not reaching all of the individuals who need it as quickly as possible.
You told us it had been fixed, and now you've accepted that it hasn't. Look forward to speaking to you again, Mr. Jenrick. I'm sorry that you are under fire this morning, but somebody has to be on behalf of my viewers. Hopefully you'll come back soon. Thank you. Let me know your thoughts. You can tweet me directly if you would like to, at Kay Burley.